Understand what is this restrictive lung conditions. So we have seen many obstructive lung conditions. There is a difference between obstruction and restrictions. So we have already seen this as a practicals in our class. Like obstructions, something like, for example, you want to come inside the room, the door is in between. That is called obstruction. The door in between is not allowing inside. Something is stopping you by obstructing. That is obstruction. What is restriction is very easy. Like the opening is there. I mean, the door is opened, but instead of freely coming, we are keeping like 2 3 desks in between and making the pathway narrow, so the restrictions is there. So this way only we are going to see the airway disorders also, obstructive lung diseases and restrictive lung diseases. It is also one of the chronic condition, and it's limit the ability of the lungs to expand during the inhalation. That is what. So the pathway is fine, but the lung has to expand. The lung has to get the proper inflation, but that is not happening. That is the restrictions. Okay, the range of chronic health issues can restrict lung performance. There is no cure, but the conditions can be managed with the medications and PT. Okay, so when we are talking about the lung conditions, the long term, the chronic lung conditions are always two. One is obstructive lung diseases, and another one is a restrictive lung diseases. As we know already, the obstructive one, which is going to block and it is going to narrow the pathway, but restriction is something like it is not allowing the what is that, it is not allowing the lungs to get expand. So keep that in mind. The lung has to expand to get the proper gas exchange. The pathway is fine, but the expansion of the lung is not happening because of some restrictions. Here, the lung is wanted to expand, but the pathway is narrow or it is obstructed. That is obstructive lung diseases. So here 80% obstructive lung disease, 80% of the lung conditions. Here it limits the entry of oxygen to the lungs. So example of obstructive we have seen already: bronchiectasis, COPD, asthma, these conditions. Here like 1 by 5 of the lung diseases, and it is a progressive one. So rest of the things we have seen, I have given the notes that you can read through that. And apart from that, what and all we have seen as a symptoms is anxiety, depression, fatigue, all those things happens. Restrictive disease, restrictive lung disease is like a comorbidity along with that. If you see any kind of muscular level, like in poliomyelitis, in cerebral palsy, the respiratory muscle is getting affected. That is why there is a tightness, there is a spasticity in the respiratory muscle. So it is not doing its work properly, and it is affecting the lung inflation. Okay, so that we can improve it through the exercises as well. And even postural deformities will also get into the restrictive lung diseases. So I have given you the notes, you can go through that. You can see like how the oxygen therapy is working now. Different methods of oxygen therapy has been given, so we can apply those kind of techniques and we can see how this restrictive lung diseases can be overcome. Moreover, for the underlying comorbidities like cerebral palsy or poliomyelitis or postural dysfunctions, you have to go for your regular exercises, and you have to suggest a patient to do the exercises and postural correction to get rid of this restrictive lung diseases. Thank you.